Hello, everyone. Thank you so much for joining us for the Blockchain in Healthcare webinar series. Today, I am thrilled to introduce our guest speakers who are going to be covering the Patientory Stiftung, Patientory Inc., and PTOY Tokenomics. This is going to be an extraordinary discussion. I'd like to start by introducing our panelists, and then I'll go over some housekeeping about the event. Krissa, could we start with you? Krissa, would you like to do your introduction?
Hi, everyone. Yes, can you hear me?
Yes,
Okay, great. I'm Krissa McFarland, founder and CEO of Patientory, based here in Atlanta, Georgia.
All right, thank you, Krissa. I don't know if you want to do any more troubleshooting. Your audio was still a little tough to hear, but we could hear you.
Okay.
Okay, how about Vijay?
Hi everyone, good morning. This is Vijay. I'm the Director of Technology for Patientory. I'm very excited to be part of this panel to talk something about what we are doing here in Patientory. I'm really excited.
Fantastic, thank you, Vijay. And Michael.
Hello, everybody. It's a pleasure to be here, and we're very excited about today. My name is Michael Bulmer. I'm Director of Operations for Patientory Stiftung. Stiftung means foundation in German. So we'll explain a little bit more about that as we move forward. But my background's in consumer healthcare with JD Power and Associates and digital medicine with VRAD and Nighthawk Radiology. And for the last several months, I've been with Patientory, and we're very excited to tell our story today. Thank you.
Great to have you. Thank you. And Mohsen.
Yeah, this is Mohsen, Managing Director of Patientory Stiftung. I am usually the guy who is fighting with Vijay about the technology. And I am a dreamer of the future, and I believe in precision medicine. I am very excited to be on that webinar today, sharing a lot of information with our audience.
Thank you so much. This is really going to be, I know, an exciting conversation. So for the audience, everyone has joined on listen-only mode. You don't need to worry about muting your phone. We're going to go through 30 minutes of presentations delivered by our guest speakers, and then move into a 45-minute panel discussion, and then 45 minutes of audience Q&A. I wanted to tell you ahead of time the way that the Q&A works so that you can prepare for it. There is a Q&A dialog box included in your GoToWebinar utility. I encourage you to capture your questions and throughout the course of the presentation and the discussion, but please know that we won't actually be looking at those questions until we get to the Q&A segment. I'm going to be moderating the audience Q&A and the discussion to follow, and each person's question that gets answered, I'll be taking you off of mute, and you'll have an opportunity to rephrase your question and engage directly with our guest speakers, and I'll put you back on mute and we'll go to the next questioner. So I'm really looking forward to that, and thanks in advance for capturing your thoughts as we go. And I really think it's going to be a terrific discussion here. So before we get started and move on to our presentations, we just want to ask the audience a question, and I've just launched a poll about wanting to understand what you as the audience members see as the single biggest value driver for blockchain in healthcare right now. We did give you the option to select more than one answer, which could be interesting. And I can see as votes are coming in on this, and we've got about 26% of you have already voted, which is terrific. I want to get that to the 90% number, and then I'm going to close the poll and display the results, and we can just have an understanding of people's perspectives going into our discussion. All right, you should see, for those of you who haven't voted yet, there should be a little dialog box that popped up. Just one click there to let us know your perspective. Give it just another couple moments. All right, well, thank you. I am going to go ahead and share the results. Okay, so this is what we've got, a pretty even distribution with an emphasis on price and data transparency and patient empowerment. Interesting. Any reactions to those responses from the audience, from our panelists? Mohsen or Krissa, any reaction to those things?
Yeah, maybe I go first. I think the result is not surprising me. I think looking around the world and seeing what are the challenges in healthcare and what healthcare providers and hospitals and governments are actually fighting with is reducing the cost and making everything transparent. And of course, having the control in our hand as patient, that is the fantastic thing as well. I think the other points are also important, but I would have done the same thing, the same board. I'm happy everybody is on our side and we are on the same page.
Fantastic. Agreed. So at this time, what I'm going to do is Mohsen is going to be the first presenter, and Mohsen will let the other speakers know when it's time to come on. All the rest of us should drop off of webcam at the moment. So Mohsen, you stay on, please. And then we'll be back after the presentations. All right, Mohsen, I will drive the slides for you.
Thank you. Yeah, first of all, I think I have the pleasure to guide you a little bit to explain what is Patientory, and then the next part is basically talking about the vision and the goals of the Patientory, and then I would like to very briefly bring you to the level of dreaming. This is what I warned you. I am a dreamer, and I think and I love precision medicine, and I would like to share with you at least one slide which is also emphasizing this point. So Patientory Stiftung, I think Michael said that already. Stiftung is foundation, is the meaning is foundation. We are sitting in Switzerland, and it is, as mentioned on the slide, is a non-profit healthcare organization, is a blockchain member organization. That means an organization where everybody can join it and be member of this community. We call it HealthNet, and you can contribute to the success of a blockchain in healthcare in the future as well. That is actually what this Stiftung is responsible for, and basically, if you want, just we are bringing the technology, we are discussing the technology with people, with members, we are going through different projects. You know, we are sharing as a community where we share knowledge in order to add value to the blockchain in healthcare. I personally look forward to this community and the conversation we will have in the future. And part of it, by the way, is the summit in Atlanta on 31st of May, where I would like to see many of you guys also coming there and challenging us. The mission, I think all of us in healthcare, we have one fantastic goal, and this is what makes us passionate. We are saving life of people, I think. And Patientory Stiftung is also looking at that and having this challenge to really bring this knowledge to people, educate people, help in this educational process, bringing people up to the level, not only on the technological level, but also on the economical level. What is actually blockchain good for, and how we can use it in order to add value to healthcare in the future healthcare. So it is. We are talking about the open source DLT actually, and decentralized software architecture. So this would be also those conversations we have, but not only on the technical level. So, and I will be most probably excited having also people from different part of the world coming and presenting to audience and talking about different topics such as standardization, such as safety, reliability, interoperability, and all those important things we could not solve in the past. Now with the blockchain technology, we can. So again, the last point on that slide is very exciting to me as well. We are bringing people together with events and summits where we really can do this knowledge sharing and really together accomplish this huge task. Looking at the next slide, it is very clear that on what points and topics we will be focusing. We will not explain that in the community by ourselves. We would invite people, subject matter experts, talking about all those things you see here on this slide. And I think open source was mentioned, interoperability was mentioned, visibility, affordability, security, data protection. Patients are really, really scared of what happens to their data, especially in the genomics data. So who can decide and who can judge about me and my personality and what job I can get in the future? And we want to discuss all of this, giving this impression to people saying blockchain is helping you to really have a safe environment and you own your data. But what we are creating, again, that is a monster, and we are happy to have this open source and this community so that we can do it together with you. So topics are not only that abstract as you see on that slide. On the next slide, you will see also, of course, technical topics. We will have technical people coming to the platform and to webinars and different communication platforms talking about all these points you see on that. Yes, we understand the wallets. Yes, we understand the blockchain technology. Yes, we understand what is on-chain service, what is off-chain service, and all those smart contracts, programming language. Everything, I just took a couple of them. You see this ... We will have conversation about that point as well, because honestly, if we do not understand it good and we cannot make it short and simple, actually we didn't understand it. So we have to look at it and work together and bring this fundament, bring this framework, which is helping us to shape the future of healthcare. And I tried actually to create a slide couple of days back, and it is the next one, which is actually showing the vision. And that is this one. So now we can discuss which arrow should go in which direction, but that is not what I wanted to demonstrate here. I wanted to show that if you look at on the left top side, you see patient will have, through a handheld system, will have the control of the data, talking to the private public hospitals or the clinicians, and having the same conversation as today. And then once the patient says, yes, I would like to allow him to see my data, pushing the button on the mobile phone, and then the clinician can see the data, which is blockchain on that green framework you see in the middle. It is called PTOY blockchain. So my colleagues will explain more about PTOY blockchain on the technical level. But also, you see, I wrote down a couple of blockchain services which will help people, foundations, companies, friends, members, to look at the functionality or reuse the functionality we have in PTOY blockchain. The data is not in the green part. We are not replicating data. And you see, insurance is also, interestingly, also part of, I mean, this has been always the case. They are part of the game, and you could put more contributor to this network, to this ecosystem. What I wanted to demonstrate to you was only to tell you that we are together based on the open source technology, blockchain. We want to create this fundament. And what is, assuming we have this data, what happens then? Then actually the work starts. And if I may ask Heather to push one more time the return button, or one button, then you will see what happens. Afterwards, when you have this fundament, you will see other companies, other members coming with each block. So you see on the left side, for example, companies being busy with artificial intelligence in area of liver function, diagnosis of liver issues, problems, and also treatment recommendations. So they would actually put their application on that blockchain, PTOY blockchain, and reuse the functionality we are creating together in a very on an open source level. So, and that is the dream I have. I think the beginning is to create the fundament, and then afterwards bringing people work together hand in hand and really create the future together, going through the precision medicine. My dream is that I log in on Patientory's mobile application and say, okay, now I would like to see whether I have diabetes 2 or 1 or not. And I would pay 2 PTOYs for that. And I would wait maybe 20 minutes, and the system should tell me, Mohsen, you have diabetes 1, you got to talk to your clinician. Here is the number of 3 you can talk to. And I could connect with my clinician and say, this is what the machine is telling me, what do you think? And he would say, hey, Mohsen, right, you got to do some exercise, otherwise you go to diabetes 2. So, and that is the very, very simple exercise. I have on that panel actually cardiovascular disease, we have lung cancer, we have stroke, HIV, and genomics is also part of it. And I believe this is an amazing, amazing journey. But for that, we need blockchain, PTOY blockchain as blockchain in healthcare. And we need to work hand in hand together. So I'm done with my slides, guys. I don't have anything else. I look forward to the conversation with you. Except one point, I want you to join this membership, to being member and join this community. So me, Krisa, and other guys on this channel and other companies alone, they can't do that. We have to work together. And blockchain is enabling us, and we just need to work together. Yeah, that's it from my side for the time being, and looking forward to the conversations.
Thank you, Mohsen. Okay, I think we need our next speaker up. Or go ahead, Michael. Thank you.
Yes, hello again, everybody. I think, as Mohsen just said, we really are looking for members to join us, be partners with us, and grow with us, and spread the word. So here you see some of our foundation members to date. It includes Hyperledger, Linux Foundation, HIMSS, CryptoValley. CryptoValley is the code word or code name for Zug, Switzerland, where we sit. Our corporate offices in Switzerland sit in Zug. CryptoValley is really a Silicon Valley type atmosphere for blockchain startups and companies. It's a fascinating, exciting place, and I encourage all of you to come and visit if you're traveling through Europe. Switzerland is not a bad place to stop by and have some hot fondue on a summer day. There's also member directory. We have Block Cipher, Patientory Inc., which Krista will be speaking to shortly. So we want to see this list grow exponentially as we move forward, and we hope that you're a part of it as we go forward. So the next slide talks a little bit about the upcoming summit. Heather, it's fun to see you start with the polling question and to see the results, more importantly. Consumer empowerment came up as #1, and that doesn't surprise me, much as Mohsen said. Consumer empowerment, we're all consumers, and blockchains is disruptive. It's going to affect the world. It is affecting on a very small scale today, but it's only going to grow. And I just came from the Consensus conference in New York City, and talk about growth. That conference started, I think, with 50 people in its first year, and now it's over 9,000 people this year. So the word is out, but out of all the panels, you have fintech and you have real estate, you have all these different industries that are going to be disruptive, but it's healthcare. Healthcare is the most important one that touches everybody. You may or may not own real estate, you may or may not invest in different forms of financing, but you're certainly going to need healthcare as you move forward in life. And we want to make sure we're getting the best. And what blockchain brings and what Patientory will be spearheading is the precision medicine side of this very important area of healthcare. So we're excited. On May 31st in Atlanta at the Four Seasons Hotel is our inaugural summit. And on the screen, you can see we're inviting over 300 healthcare professionals and blockchain experts and future blockchain talent. And that's all of you out there are included in this. And we really hope you can come to Atlanta. It's a great city. It's not too hot yet on May 31st, but we promise warm weather nonetheless, maybe a little rain. And in a wonderful surrounding of the Four Seasons. It's very intimate. We didn't want a huge space to keep the conversation more one-on-one as possible. And some of our keynote presentations and Ask the Expert panels will include disrupting the model, consumer-driven healthcare, which is very close to my heart, blockchain healthcare use cases. We have an exciting panel from around the world participating in each of these topics, actually. Disrupting the genomic industry with blockchain, as Mohsen just said, that's very exciting. The leaps in technology that we're going to see and the effect on precision medicine will be tremendous. And I think we're going to hear very exciting keynote speeches in this area. Quality measurement, value-based programs, also very important. We need to make sure healthcare is not only available, but it's of quality value. That we're getting the best care possible. Regulatory implications in securing data, very important. And then we have an expert-led Connectathon being led by Jim St. Clair. He's an incredible guy. We will learn a lot from him on this day on May 31st. And again, this will be a wonderful forum for all of you to come and actually sit in the same room and participate. So this now leads into our business structure overall. Mohsen did a nice job of giving the background with the Patientory Stiftung, which includes an annual membership based on the size of the organizations. We also are very concerned about governance and regulatory issues, and we'll be monitoring and working with the authorities around the world to make sure that we're in compliance and again, adjusting the blockchain to fit the unique environments of individual nation states. Most importantly, this conference summit, as I just mentioned, the inaugural is May 31st, but we're looking at having our next in Dubai, possibly in Switzerland in the first quarter of next year. And really, we seek to have a conference in every major part of the world over the next year to 2 years. So please follow us on this journey, the Patientory Stiftung. Be a foundation member, and you will be able to write to us at any time. I think we're going to end with some information for you to get in contact with us if you would like. And I would like to now hand it over to the Patientory Inc. part of our wonderful organization, which is Chrissa, McFarlane, and Vijay. So, Chrissa, if you would like to take it over.
Thank you, Michael, for that wonderful overview. So to start, we had Michael and Mohsen do a great job in introducing the Patientory Stiftung and its goals. So where does Patientory Inc. fit into this? I always like to start out with the background behind the company and how it came into existence. So a little history. I founded Patientory from both my personal and professional experiences and frustrations with patients not being able to have an actual central depository of their own health information, as well as, of course, access support from a community. And we've all had that experience of going to the hospital and having to fill out countless forms at every single visit. So the core purpose of Patientory Inc. in making healthcare data secure and accessible is to empower patients globally. And this mirrors very well with our mission and integration with blockchain as the underlying technology that would enable patients, but also their caregivers, to take account of their health, which overall will improve the quality and well-being of our population. So Patientory Inc. is a distributed application that is primarily integrated on top of the PTOY blockchain network. And I'll get into our business structure later on. We were incorporated in December 2015 and started in January 2016 as the inaugural company, a part of the Boomtown Health Tech Accelerator in conjunction with Colorado Permanente Medical Group, also known as CPMG, in Boulder, Colorado. So we worked alongside with their doctors in order to create a solution for the entire healthcare workflow. Since then, we've been able to have partnerships with leading blockchain companies and healthcare companies such as Cipher and Dash. So the past 2 years, we really laid the foundation of building a distributed application, which would eventually integrate with a blockchain network, which the PTOY blockchain, was launched with the PTOY token last year in May 31st, 2017. Since then, we received both national and global market validation, and we were recently named the top 11 company disrupting healthcare in 2017 and 2018. Going to the next slide. So in order to achieve, the structure of getting not only healthcare organizations on a blockchain network, but actually using software that integrates in the blockchain, we can take it a step back and, and think of the current problems that exist right now in the global healthcare landscape. So there are really 3 inherent problems. With over 7 billion people on the planet, providers have to care for the growing number of people diagnosed with a chronic health condition whose health information is distributed all over the place. And as with the new technology such as blockchain comes new business model. So as I mentioned before, we are a SaaS-based platform, also known as blockchain as a service. And we sell directly into those healthcare institutions through a license agreement once they've already integrated into a blockchain network. So our software consists of a hospital dashboard, which manages the provider's patient population that integrates into data from an electronic medical record keeping system, or in the case of genetic institutions, it's more genetic data. Overall, it's all patient patient-donated information. The patients, on the other hand, have access to a patient portal where they retrieve that information from either their healthcare institution as they go through that continuum cycle, and they're able to store this information via a wallet portal. So they have, when they actually create and download the app, they set up an encryption key, which is a 21 long mnemonic that ties back to their personal identity. And then I can turn it over to Vijay, who will go deeper into the technology and how the functions of it actually work.
Thanks so much, Krissa. All right, Vijay, you're up. Oh, I think you're muted, Vijay.
Oh, okay, sorry.
There you are.
Thanks, Krissa. Thanks for that wonderful introduction about patient-reading software. I'm Vijay. I'm the Director of Technology for patient-reading software services. So I'm just going to go over some of the key initiatives, what we are working on, and share some exciting information about how the technology is coming along. To start with, a patient-reading software is a suite of services and framework runs on PTOY blockchain network. PTOY is a utility token. It is built on top of Ethereum, and it is ERC20 compliant. And the transfer of token happens through the network using smart contracts. When we consider Ethereum as a backbone or the engine for our PTOY network to run, we consider PTOY as the fuel for that engine. So the primary objective for our software services is build a rich set of tools and frameworks and services for the health providers and patients to go and use it to solve their real world problems. While the providers use our services to make use of it, they can earn or they can pay the services using the PTOY. So that way, one currency, one cryptocurrency within the network, everybody can make use of it. Maybe if a healthcare provider wanted to pay some patients to access their information, they can pay in PTOYs. Likewise, if the patient, if they want to leverage some of the services and tools within the network, they can pay in PTOY to get that services done. When we talk about the permission blockchain, actually the network we have right now is a private fork of Ethereum. There is a difference between the public and permission network. In a public network, anybody who has a Ether address can go and look back about the transaction, and they can see the logs, like how the money get transferred and what are all the activities that account has been done. That would not be a very suitable architecture for a more sensitive and more privacy needed healthcare domain. So we took a private fork of Ethereum and we make it a private permission network so that we have more control over like who is joining the network and who is leaving the network. And the consortium, they have more control over the governance of knowing like who are their customers and who are willing to join the network and how we can permission them to make use of the rich set of data available in the network. Likewise, the patients, also the healthcare providers, have more privacy where we can define like who can access the network, who can access the data. Like for instance, if patient A wanted to have some services provisioned in hospital B, we can enable only the transaction visible to both the parties, and the rest of the world would not know like what's happening between those two. So this kind of abstraction gives us a mask to maintain the privacy between the transaction and the parties, which would solve many problems that exist in the healthcare space at this point. So the next one is the decentralization of the healthcare, the health records. So one of the main problems in the, I'm sorry, Heather, maybe I am not done with the previous slide yet. Yeah, thank you. The decentralization, one of the main problems in the healthcare is the managing the system of records, because different parties hold different part of the information. So when the patient wanted to access or transfer that information between care providers, it became a hassle. So doctors at the point where they need the record the most, they're not able to access those data because of the delay in the process and the approvals and the HIPAA compliance regulation in place. So the data transfer is not seamless. So this gives extra stress to the patient who's already needed a care, where the doctors and so care providers are not able to concentrate on the patient, but until they get the records. So to solve the problem, the blockchain inherently has its advantage of cryptographic encryption, where everything inside the network is encrypted. So nobody can access the data until they have the permission to view it. So that saves us a uh, go-to platform for the healthcare needs, where patients can go and maintain their records encrypted all the time, and they can unlock only for the parties who they wanted to give access to. So that way, patient have the whole control at any point in time, like maybe with a smartphone in their hand with our Patientory app, they can unlock the data for a particular care provider without going through all that documentation and paperwork which they need to fill in to transfer the data between the parties. So that is kind of a big relief for the patient who already needed a care. With the help of a smartphone, they can decide like who can access their data and who cannot. With the basic immutable nature of the network, uh, this also with the accessibility of the transaction logs where they can go at any point in time, we can go back and look at the audit trails and see like who has the information access and what they have done with the data. So patient have more control over like maybe if some malicious activity happened, they can immediately counter that and say, okay, this party is trying to use my data in a not compliant way, and they can say they can revoke their access at any point in time. The other set of services what we are doing is a value creation, because there is huge set of data that's going to reside in our PTOY blockchain network, where patients can make use of it at any point in time with just click of a button in their smartphone. Likewise, the hospital providers, also the insurance companies or drug companies or other pharmaceutical companies, if they wanted to make use of this data, with the consensus of the patient, they can make use of the data anonymously or with identification. So with that, patient has a leverage now. They can take part in the research what the companies are doing and earn some PTOYs in return as their appreciation, and they can build their wallet with their PTOY tokens, so that PTOY tokens can be spent anywhere for other services like uh, copay copay payments or paying the premium for the insurance. They can make use of that. So all that has been built into that one system, where our goal is to provide rich set of services for the patient, so they don't have to go out of the network to look for any other information. Everything is baked into the same PTOY blockchain network. This is a interesting diagram about the software overview about like how the Patientory Inc. software services works. Like the bottom green portion, what you see there is the set of services. It's a subset of services at this point, I would say, where we have built services to enable development of DApps for the patients, for the doctors, for the hospitals, and for whoever wanted to make use of the PTOY network. They can easily access our services, and they can build their own decentralized applications on top of it. So for some services to mention, like diagnostic AI services, maybe the patient data is already residing in our network all the time. Uh, AI-based diagnostic service can look at the symptoms what the patients have, and they can recommend like what kind of diagnosis or what kind of lab test they need to have. That way, any alignment they can identify at a very early stage, and that helps patient as well as the care providers to take appropriate action on the course of treatment as and when they identify the problem. So this is one of the use cases which we are working on right now, but there are n number of use cases similar to that. we are taking one step at a time and trying to build the essential services that are needed to make use of the rich set of data which we have inside our systems. So the next one would be, this is a typical clinical support overview, like a patient. He's going to his primary healthcare physician and wanted to go and look at a specialist. He wanted to transfer some of the data which we already having stored there. In the current world scenario, they have to sign all the paperwork, and the data transfer took weeks or months to get from the PCP to their specialist. But thanks to the Patientory PTOY blockchain, where everything's stored in one unified system, where with the click of a button in their smartphone, the patient can provide the information transferred from PCP to their physician. And the physician can take appropriate action based on the data what they receive, and they also have tools available within the software services framework which will help them in their diagnostics and further treatment. So this will be I mean, for the patient, it's kind of they don't have to do any other extra work just to give approval for the specialist. But specialist with rich set of tools that is available and comes along with the PTOY network, they can do a better diagnosis, and they can store back whatever the data they wanted to give to the patient in the same blockchain network. Yeah, with the next slide. So this is one of the distributed application which we are developing right now, and it will be released for beta testing very soon for a limited set of beta users. So the primary goal of this application is to capture the patient's activity and their vital stats from the mobile phones using the Apple Health Kit, and try to push that information to our PTOY blockchain network, where all the data about the user's activity have been stored there, and we apply some algorithms on top of it to suggest like the users how he can be better active and maintain their healthy lifestyle. It will give a dashboard where the user can see like how their goals are met. Like maybe he can set a goal, like maybe he wanted to do 10,000 steps in a day, and it will show like, okay, you are done with the 6,702 steps today, but you are still around 3,000 steps to go. It will motivate the patient to do more activity, and at the same time monitor their health vital statistics to recommend like what can be a better change to their activity. Like maybe if they are more interested in cycling or swimming, we capture all the data. We form a pattern to see how the user is active throughout the year, and we recommend some activity based on that. With this is being stored in the PTOY, so the user PTOY network, PTOY blockchain network, the user can spend more PTOY to buy more storage space within the network and have more information being uploaded to this, so that all the information what he needed related to his health can be maintained in one wallet with information being pulled out from the PTOY network. So this will be available for beta testing. We are planning to leverage that for limited set of users in the near future. So that is what we are doing right now with our Patientory services software. We are very excited to leverage like the AI tools and other set of frameworks what we are developing to be used by other developers to see like what kind of applications that we can build to solve the problems in the healthcare space. That's all I have, Heather.
Thank you, Vijay. I appreciate it. So let's have everybody else come back online, our panelists, to get into our discussion. And we're going to leave this slide up so everybody has a visual reference as we're talking. Wow, you all have accomplished so much. It's really exciting. So the first question that I wanted to just pick up on, which was right where you left off, Vijay, about your beta program. And maybe you could give us a little bit more detail on how you're selecting your beta partners, maybe some process of what that's going to look like. Are you looking for other participants? And maybe Vijay, you could start, but then I'd love to hear from the other panelists as well, because moving into that beta stage is a big milestone. I'm sure you've worked really hard to get there.
Exactly. Yeah, we are really very excited to have the testnet ready for beta users. So the onboarding, it's in the process. We are kind of going to invite few beta test users to come and test our application for a limited period of time for us to uncover and see like how the pattern of usage is, and based on that we will try to make any necessary changes that is needed before we unveil it to the general public. So Krista can add more on that, like how we are going to onboard the beta users.
Thanks, Vijay. Absolutely. So our goal is we're having a VIP launch party after our summit on the 31st. So the goal is to invite attendees to be our first beta testers, and then over time we will reel it out to our community and the public.
Oh, that is so exciting. And I'm by the way, thank you for having invited me to serve as a speaker at the summit. I'm really excited about that. And I didn't even realize there was going to be a big party. Now I'm even more excited. It sounds well. Yeah, absolutely. So will in the beta scenario, will you be working with real health data? So will beta folks actually be sharing real health data, or will they be working with kind of more dummy data that's going to be used for testing purposes? Thoughts on that?
So the intent is to contribute your actual health data. So as Vijay, as you saw on the previous screen, a lot of that data can come from your wearables or devices that eventually you contribute to your profile, and that gets stored on the PTOY blockchain network.
Terrific. What about, will there be institutional partners during your beta program, or sticking with strictly patients only during beta?
So the beta is patients, consumers only, and then of course we have the partnership I mentioned earlier with Dash and Block Cipher. So we've integrated a lot of their APIs and services to the tech stack as well.
Exciting. Maybe we could talk a little bit about Block Cipher and Dash and understand their the relationships there and what they're contributing to the architecture and the solution. Maybe let's start with Block Cipher, and maybe someone could be kind enough to introduce the audience just a little bit to who they are, since they're a key partner of yours, and then how are they? And then let's talk about Dash quickly and bring everyone up to speed on that piece. Who wants to describe Block Cipher briefly?
I can do it, or Vijay can add after. So Block Cipher is, one of the leading blockchain web-based services companies. You might have seen their logos if you currently buy or trade tokens on any exchange to date. So they have APIs for Bitcoin and a lot of the ERC20-based tokens. We announced a partnership with them last summer, where they currently have Dash as the third party in the partnership. And our focus is really going after healthcare payments and how can we mature the industry and start building use cases out for making payments within the healthcare cycle and infrastructure. So looking at, insurance payments and looking at, if a patient might go into a hospital, how can they easily remit their copay or just bills using actual cryptocurrency.
That's a bold idea. That's a very bold idea. Vijay, did you want to add to that about Block Cipher and Dash?
Sure. We plan to have a Dash wallet inside our HealthKit app, what we're developing for the monitoring the activity of the users. So we kind of used Block Cipher as the API exchange where we communicate with the Dash using the Block Cipher APIs. So people can use this HealthKit app as their Dash wallet, so they can store their Dash currency, cryptocurrency into Dash wallet, or they can send payments to other parties using the Dash.
So from a token exchange perspective, is it accurate to say that you're really viewing Dash as a key exchange partner for PTOY tokens, and that's going to be an important vehicle for fungibility and broader transaction participation? Is that right?
We can say it as a wallet, a Dash storage partner, where we create the Dash wallet for the transaction to enable the transaction. But for the payment, we have not decided yet whether we wanted to go directly with Dash or not yet, like the co-payments and other services.
Interesting. I think about how in the United States, healthcare expenditures are about 20% of our gross domestic product. I'm wondering, what would your perspective be on the issue of volatility for payments and also money supply? And do you have a vision where, do you think that it is a part of your strategy to try to position PTOY as a token, as a large-scale payment foundation, very broadly, or do you imagine it being really only used in certain use cases in a limited way? Can you articulate, maybe Mohsen, you could take this one as a long-term vision. You described yourself as a dreamer, and I love that. Where do you see the PTOY tokenomics getting to in your most broad vision of what you'd like to accomplish with it?
I think you're on mute.
Oh, I'm having a little bit of audio difficulty. I'm sorry. Could you say that again, please?
Can you hear me now better?
Yes, much. Thank you.
So I said, I think my dream is PTOY should be actually the money people working in healthcare with. That is the big dream I have. And this is why we created that. Well, Krisa has created that before I actually joined. And that is fantastic. And I said that also during my presentation, people must be able to buy those services we together, the world of healthcare providers are going to provide to them, so that they click, and they don't want to take care of how complicated it is. It should be simple, pay 2 PTOYs, and I don't know what is the PTOYs price in the future. I'm just saying 2 because 2 is a small number. So get this service and get healthy, because our goal is not to make money necessarily. This is not the primary goal. We want to help people, we want to help society, and again, we want to do that earlier. And this should also motivate people to do that. If you put money on it, if it is PTOY, we can give them sometimes other awards. I mean, this is not new to the society. A lot of companies out there, you can get your treatment and you get even tokens back, and this is your award. And nothing better than this. My dream is that my son in the future is working only with PTOY in healthcare.
Wow. So what do you think about volatility? Do you imagine PTOY becoming something like a stable coin, or pegging it to a stable coin, or pegging it to a fiat? Or do you think that the volatility is not a challenge, or have a different way of thinking about it?
Well, I believe there will be a volatility there. It is the nature of those tokens. It goes up and down because people, invest and they see that differently. But as soon as everybody is using that, the volatility is not that high. I would anticipate that.
So eventually, it will settle to a point that the volatility won't be a problem per se, and you won't need to fix introduce a different algorithm that tries to turn it into a stable coin or something like that. You feel like the market economics and the scale and the utilization will solve that on its own.
Yeah, I believe this will be, use in healthcare and no speculation behind that, but it will be from country to country, most probably different value behind that. How in the future it looks like, I don't know, but I believe it should be stable so people can afford it, can use it, and exactly do with the token what we want them to do, namely contributing to their health, taking those services, reducing costs in healthcare.
Yeah, it's an interesting challenge that many organizations in the space are trying to work through right now, in the sense that if people hold tokens and they believe they're going to appreciate in value, they may be less inclined to actually spend them and consume them. And that can create a disincentive that I know is a big challenge, not only for your organization but really broadly as we how we address that. In your beta program, are you doing an airdrop of tokens, of PTOY tokens, or are the beta users buying in to a certain amount, or how is that going to work? It's going to be really interesting.
Yeah, so in that business model I mentioned before, so consumers are actually on a freemium model. So the PTOY already is baked into that storage infrastructure. So for our beta users, they're not necessarily having to buy the PTOY as yet, because we don't see a large amount of data being stored and transferred.
So they'll have a certain set number of PTOY tokens that come with their freemium level, and that they're probably not going to exceed the storage capacity in the context of the beta program. Got it. It's going to be, it's so interesting, and I'm so excited for all of you, because there have been so few real world production experiments that have actually had an opportunity to see what consumers will do, what healthcare consumers will do, and what might start emerging as we're looking at a real, albeit small during a beta, but a real live real live experiment in early health tokenomics. It's in fact, you may be one of the very first. I think you probably are. Yes.
Definitely.
Yes, definitely.
That's what an honor and a privilege for all of you to have to be in history, to be remembered as such intrepid souls. What you've done to get this to the point where you're able to actually start seeing what happens when we try these things that we all spend so much time talking about and theorizing about. It's extraordinary. Well, so along those lines, I'm super interested. There's so much that the whole world has to learn about the way that the behavioral economics will work with the incentive structures. And so often in history we see that people don't behave the way you think they're going to, and which is why you have to have this experimental mind of looking at this. How are you planning to share what's happening, or relate to the world what you're learning as this beta program is being communicated? Thoughts on that?
Who wants to take it?
No, I'll take it. Yeah, part of that is, we really have a great community, and we currently have, updates via our Slack channels, via our social media channels, as to the progress, on both sides, on both, the Stiftung and what we're doing on Patientory Inc. So we want to continue sharing that information via our channels, via our blogs, via our press releases. And that's all part of the education portion, via our conferences and summits in the different regions. So that's really the goal, is to really scale and continue to educate the market and make people aware of the benefits of blockchain in healthcare.
I just wanted to underline what Chris has said, but I think also this is one of the huge challenges we have in the market. I don't know how often we were going around the world with Krisa recently, and people from different organizations, they talk to us, they talk about blockchain, and we sit in front of them and they ask what is the concept, what we do, and they look at us like this, say, can you repeat it one more time? Can you repeat it one more time? Can you repeat it one more time? They are not cardiologists and radiologists, they are technical guys. And we talk to them and we recognize, Jesus, they don't know that much. They don't know that much. And that is exactly why we created the Stiftung. We said, let's work together. This is an educational stage where we also need to learn from others. I don't believe that we are perfect as well, but only we can learn from each other. And I think if this not happen, For example, in Middle East, in Dubai, we may not be able to introduce Patientory to them because they still do not understand what is blockchain. And this is why we have the next activities in Dubai with partners and with hospitals. I cannot name them, unfortunately, right now because the contract is not signed. But there are activities, and we are working with people to really educate people first, and then working also in the in the backside, working on that complicated technology, I have to say, where the law is still not there where it is supposed to be, and there are a lot of questions and lawyers. I was with one of them before I come to this call, and he was looking at my face again like this: can I do my homework, or you come tomorrow? And that is educational part of it, and I'm excited to be part of it, and I am learning as well every day, and we have also our internal call, learning from each other.
Boy, I wish you were willing to break the names of your institutional partners on this show. I would be so exhilarating. But congratulations! I'm sure those contracts are going to come to bear, and having an institutional partner as part of the beta program is going to be such a value add, just tremendous. So I had one other question I wanted to ask you, and then I want to go over to questions from the audience because we already have a big long list, which is exciting. I wanted to ask about the off-chain data storage and also the use of that for the purpose of training AIs and conducting machine learning activities. That is, I really like the approach that you're taking by making that front and center. And a weakness that I've seen in other strategies is that it's almost magical thinking. Because there's this belief that you can just have pointers straight into legacy systems with no tier in the architecture to deal with aggregating, analyzing data. So maybe I'd love to hear just a little bit of thought on how you're going about that technically, because I have a feeling we're going to have some questions from the audience about that. And I also think it's interesting that you have actual storage as part of the transactional model for PTOY. And Vijay, you're nodding about the significance of it architecturally for sure. Maybe a little bit of thought about how you're using that, how you're getting data in there, how you're administering and governing that data, scoring or ranking provenance, things like that.
Sure. As respect to the blockchain and Ethereum is concerned, like storing the data on the Ethereum is not the right way to do it because it needs a lot of gas and a lot of, it's a lot expensive than storing offline. So the approach we've taken is we are just making sure the transaction is getting registered inside the blockchain, but the rest of it, the storage of the data and other details, we're keeping it offline with encryption. So that's how it works. Like we are keeping the data storage is offline, but we are making sure that the immutability of the blockchain is being used by making sure we register the transaction in the chain.
Mm-hmm. Mohsen, did you want to?
Can I add something? And I have to underline what we just said. And this is the way technologically, and also if you go deep down and talk to those professors in Zurich, in Germany, in France, where they are really doing research in blockchain, and they do the same thing. If it comes to precision medicine and you have to compare data with each other, the machine is doing that and nobody is seeing that. It is secured. But if you go to companion diagnostics, you need more data. You can't just go online to all the data and reference it and say, okay, what is with this patient, what is with this country? You need a huge amount of data which you can't actually go online and look at them. And there must be a mechanism there that nobody can see that, but the agent and the agents, they have this pleasure. They can see our data, but still in the anonymized way. And that is exactly the future. And people in science, in different universities, in Oxford, for example, they're working on it. And we are working with those guys also hand in hand.
Yeah, you certainly have a very, very collaborative approach and a global view of these challenges, which is terrific to see. So I think we're going to go to our audience questions. So we still have plenty of time to engage with our audience. I'd like to take off of mute Peter Bachman first, and I'm gonna find you here on the utility, take you off of mute, and then Peter, if you could just quickly introduce yourself, and you had a couple of great questions about end-to-end encryption at the UX level and also GDPR compliance, which we must discuss.
Hi, Heather.
Hi, Peter. How are you?
Good. Yeah, so my question was that there's a claim that surfaced in the Patientory documentation, and I think it was also mentioned in this talk, that end-to-end encryption is used, and I was interested in the specific technical specification for that. I did take a look at the ERC 20 audit that had to do with the transferring the tokens to and from, that sort of things, where there were some concerns by the auditor. But apart from just the token exchange part, I'm more concerned with the healthcare data and how it works within various regulatory domains. This is my second question: is this GDPR compliant? So in order for, let's just say that you're attempting to monetize and therefore disrupt the U.S. healthcare system, which, as Heather said, is roughly 18 to 20% of the economy. People are going to want to know that the encryption underneath is done correctly. So if you could speak to the claim of end-to-end encryption specifically, I'd appreciate that.
Thanks, Peter. Vijay, want to take that one first?
Sure. When we talk about the encryption, we are not talking about like we are going to leverage everything on the public Ethereum. We are having our own private permission network. The cryptographic algorithm that comes along with our private permission blockchain, that takes care of the encryption needs, whether it respects to the HIPAA compliance or with respect to the GDPR compliance. We are, I mean, with the basic inherent ability of the blockchain to encrypt stuff before it gets attached to the on-chain, that gives us a leverage in our private network to do the encryption in a more regulatory compliance fashion.
Okay, I didn't hear anything technical about the explanation of the encryption. I just heard the words blockchains, compliance, and the fact that it's being held off network, which seems to make a lot of sense. But in terms of the actual encryption being used, I just heard terms. I didn't hear any actual technical description of what encryption was being used.
Yeah, it may be of a proprietary, information. So that's why we don't want to unveil that in a public domain.
Okay, I understand that. And have you submitted your encryption to any regulatory body or to any security review panels that they can then take a look and see if it's in fact secure?
We are working towards that. Maybe Krisa can add more on that.
Yeah, so I mean, if you reach out to us, I know we had our email up there. We can't actually go through that documentation with you, but we are, in correspondence with NIST and other organizations as well.
So it would be. Would you be claiming that it is NIST compliant? 863.
I would say we would want to do that, but I don't. Excuse me?
Okay, so at this point, you have a proprietary encryption system, if I heard that correctly, that you want to make NIST compliant at some point. Okay,
and
thank you.
It sounds like the organization is also looking at third-party trust assessments, like maybe there's a trustee certification, or there are third-party certifying bodies, to your point, Peter, that would run penetration and defense in-depth testing. I imagine before a beta went to production, those kinds of verifications would likely be in place. Is that right?
Yeah, and to add on to that, so a lot of these we see will be managed and governed by the consortium. So when it comes to the blockchain, I don't know if it was pointed out earlier, we aren't actually the owners of the network. This is owned by those institutions in the consortium who set the standards and goals for the production and adoption of the network. So we really just fundamentally serve as that guide and information giver to these organizations who would essentially form that.
Just to go back to my first question, then I'm done. So there really is no public documentation to support the claim that there's end-to-end encryption.
Public, I mean online.
I mean, any documentation available to support the claim that is on your website that there is end-to-end encryption.
We can provide you with that document, but at this time it is not in the public domain.
Okay, thank you.
And then, Peter, you had also raised one question about GDPR specifically.
Yes.
And I imagine you might have been referring to the right to be forgotten as a central issue.
Certainly one of them, yeah.
Yeah. So I'd love to give the panel an opportunity just to quickly react to your at least preliminary ideas about, from a policy or governance perspective or a technology perspective, how are you approaching that at the current time? Chriso, would you like to start?
Yes, can you just review that last part? I thought it was for Peter.
Oh, sure, absolutely. So we're talking about GDPR compliance, and essentially what is your strategy or philosophy for achieving GDPR compliance or asserting that you are compliant or will be compliant either during beta or following, etc. There's thoughts on GDPR. We mentioned the right to be forgotten specifically, but it doesn't have to be about that. Just your overall approach and thought processes as GDPR is going into effect effectively now.
Yeah. So it is a now. We are working with, of course, legal counsel, and especially getting those terms in the service up to be compliant, especially as we see blockchain and different piece in looking at HIPAA and GDPR compliance. So we definitely have those counselors and counsels in place, assessing from the technology standpoint, but also from the business use case standpoint. That would also be available when that private beta is launched. This is exactly why we're doing more of a private beta, so we can also test out the regulatory and compliance really with technology.
Interesting. So the terms of service that the beta users will accept as they're signing up during the after party after the summit, those terms of services, will they be jurisdictionally vetted for the European Union or the US market or a number of markets?
Yeah, so for this one, because it's based here in Atlanta, we start with, of course, the HIPAA jurisdiction, and then we'll put something in, of course, for EU as well. We do have people that are traveling from Europe who will be participating.
All right. Well, thank you, Krista. And Peter, I really appreciate your thorough questions. Thank you for raising those issues for us to discuss. Appreciate your participation. All right. I'm going to put you back on mute, and we'll go to our next questioner. I'd like to take a question from Court Robertson, who is asking a question about the Anstalt form versus the Stiftung form. And I'm going to find you here. Just a second, Court. Taking you off of mute now. Hey there, Court. I think you are now on audio. Are you able to hear us? Well, it looks like we're having an audio difficulty. So Court's specific question, I'll go ahead and read it, is how do you choose the Stiftung form of organization rather than the Anstalt form?
I'm not sure I understand that. Can you repeat that again, Heather?
I think it's a German word. Do we have a German speaker among the panelists?
Yeah, but I didn't understand the last word. Stiftung is clear, but what was the last one?
Anstalt, Anstalt. All right.
So I have to. It is a German word.
I'm not sure because
German is native German. German, so.
Court, do you happen to be, is your audio working now? Hello? No? All right. I'm going to go ahead and put Court back on mute, and we'll go to the next questioner. All right, so now I want to go to Ravi Kamapali. And if you could just very quickly introduce yourself, and you actually have a handful of really excellent questions. So I'm finding you here, just a moment. All right, Ravi, can you hear us? Okay, that did not work. We're having an audio issue. Let me try this again. Nope. All right, we're going to move on to the next questioner. So let's go to Sean O'Sullivan. Excellent question. So Sean, I'm looking for Sean, and his question has to do with EMR integration, just so you guys have a heads up. Sean, I just sent you an audio pin. You should be able to enter that and come online. My goodness, we are definitely having an unprecedented challenge with our, oh, wait, looks like that's gonna work. Sean, hello.
Hello, my name is Sean O'Sullivan. I work for a provider organization in the Bay Area, and I'm curious to see how PTOY envisions working alongside EMR and patient portal vendors who have worked to sort of create an environment where patients don't have to spend money. And I guess I want to know how this product might work alongside existing infrastructure.
Thank you, Sean. Who'd like to take that question first? Maybe Vijay to discuss the integration architecture?
Yeah, sure. On the technical side of things, like we have a private permission network, so the consortium controls like how we wanted to onboard the EMR hospitals or EHR hospitals. So when the hospital comes on board, we'll have a set of services available from the Patientory software side, where we provide access to the hospital and doctor portals to access the information from the blockchain. So that's how it works on a technical side of things, but I don't know, his question is more towards the PTOY, like how it's doing.
So, and Sean, not to put words in your mouth, but just looking at your question, Sean asked this really insightful question about how EHR vendors and their patient portals, presently patients access and use that information without a notion of paying to do so. Mm-hmm. So the question is, how do the tokenomics with PTOY come into the EHR integration, where you, if you have an institutional partner in a healthcare delivery organization, how are you envisioning that working? And I know that it's early. I'm sure there's a lot of testing and experimenting to go. And Sean, did I capture that in terms of your core question?
Yeah, because I've actually worked with patients trying to get them to use the free patient portals. So I'm trying to figure out how we would layer the Patientory experience on top of a platform like Epic or Allscripts that is sort of like their own all-in-one patient management system.
Yeah, and I can go deeper into that. So currently the system is structured. So right now the blockchain network, of course, will be open source. So it's at no charge for health institutions to actually implement the source code on top of their current legacy EMR systems. The role, the function of the PTOY token currently is a utility storage token. So it depends on the amount of network storage space that's used from the data from the actual electronic medical record system that gets pushed to the network. And then, of course, it boils down to transactions from each institution that's done on the network.
Would I be correct then in understanding that in this scenario where a healthcare delivery institution doesn't want to ask their patients to pay, that the healthcare delivery organization could be the party that uses PTOY to move their legacy data up into your off-chain storage? and that the transaction would be in PTOY, but that it wouldn't necessarily have to go to the end user in terms of the PTOY transaction. Is that correct? Like, can it be a business to business transaction only in PTOY versus depending on the relationship you might forge with a specific institution, or is it always required that the end consumer also transact in PTOY? Does that make sense?
Yes, it is both ways. Both ways actually. From the patient standpoint, they can earn PTOY when they have their data stored within a hospital, and the hospital can earn PTOY or spend PTOY if they have their storage being shared across the network. So it can work either way, B2B or B2C.
And I would like to add one more on top of it. Yes, hospitals, they will have also their own coin, they will earn also coin, but what do they want actually? So how can we get those guys involved and win their heart? So you have to really give them a benefit. And the benefit is if patients working really with the platform, looking at that, they will also get the people who are working on that data in the hospital, medical doctors, they will get more patients coming to them because they are part of this network. So if I would take the app and I see on the application, I say, okay, Mohsen, you have a problem and you got to talk to doctors, but you have 3 doctors. So one of them is in Cleveland Clinic, another one is somewhere else, another one is somewhere else, and this is the one you could choose. So I choose the one in Cleveland Clinic. So basically, that system is bringing patient to the hospital. That is again another advertisement. I mean, this is a tool for them to get patients there. There will be a fight to get us in the future as a patient. We are not easy in the future because we know more, because we are controlling it. So we will know more. We will not go to every hospital. And if they are connected, they will see more. They will get these patients per mouse click from their application connected with the doctor. And that is also where they can make revenue.
So the value proposition to the healthcare delivery organization is growth in the form of concentrating patient volume into their institution because they're differentiating their offering in this way. I feel like we should direct that question to Sean on the line, because he represents the audience that we're describing. I don't want to put you on the spot, Sean, but it seems like a very valuable opportunity to understand what you would perceive, where you would perceive value, and what maybe are some of the biggest challenges that you think would need to be overcome.
So when you were talking about the beta, I think that's one of the first challenges that kind of popped up, is this idea of having the member, or we call them members, so the patients, working directly with this platform. I think that Patientory might be wise to explore partnering with institutions that are directly interfacing with the members. And so in my case, I'm biased because I work for a physician group, but I think leveraging that relationship will allow you to bring these members into your ecosystem, but you're likely going to have to deploy these products at either the office or the inpatient level to get these members to work with this currency as sort of just a daily thing. And I think the Bay Area is obviously a great place to do that. I worry about having the beta be at the member level only, given how difficult blockchain can be to get into for the individual person.
Mm-hmm. Reactions to that from the Patientory and Patientory Stiftung team? I mean, I've definitely heard that partnerships with institutional partners are a priority for both organizations, and it sounds like they have some announcements that are still under wraps in terms of who those some of those early institutional partners are going to be. I think that's really, really excellent feedback. Well, Sean, do you have any other, either panelists or Sean, any other comments before I put Sean back on mute?
I don't. I enjoyed investing in the early rounds, and I look forward to seeing the platform grow and looking forward to supporting it however I can.
That's terrific. Wonderful. Well, appreciate you jumping on and participating, Sean. Thanks so much. I'm going to put you back on mute now. All right. Let's see. So I think a good segue here is a question from Adam Boyner. Adam has a question about hosting the nodes, and we've just been talking about institutional partners, so I think that's a really good segue. Adam, I'm taking you off of mute if you want to just quickly introduce yourself, and then you can dive into the more detailed question about who and how nodes get stood up and under what context and so on. Hi, Adam. You're off of mute, Adam. Are you there? So everything looks fine on my side, but it appears Adam isn't able to participate on audio. So I'm going to put you back on mute, Adam, and then let's go ahead and get his question answered. So we see in the diagram that payers and provider organizations would be ostensibly hosting nodes of the PTOY blockchain network. Maybe a little bit of thought about or reaction as to how those nodes from conception to launch, how they go about doing that. And I know there was some discussion about different agreements and relationship terms that would be involved in that. Maybe we could speak to that a little bit. Who'd like to go first?
Okay, I can take on the technical side. Chris, I can add on that if I missed anything.
Yes, of node is through the Stiftung. It's not really through the Stiftung, so an organization, of course, will adopt the source code and run up a node on their infrastructure. It would be good if they joined the network, which the Stiftung is currently curating to bring together those organization adopters of the PTOY blockchain. So as node hosters, you're part of this global network. And then, of course, if implementation, if that's part of the membership, so assistance with that implementation is also given to those members of the consortium.
I see. Okay, and just testing again, Adam, are you able to come on audio now? Hello? I still have you unmuted, but looks like maybe you're muted on your side. And then from an agreement perspective, are there smart contracts written or envisioned to address any of those activities, or just traditional contracts that an institution needs to sign? I know it's open source software, but it's also permissioned. So I'm curious how you're addressing that.
Definitely, we have smart contracts or during the onboarding process, whatever the terms being agreed, I think that will get into a smart contract and deployed to a private network. And then that contract will take care of the functioning of the different organizations within the network.
Okay, any other reaction to that question? No? All right, so let me take a moment and scan all of our questions, because we're starting to get low on time, so we can probably take 4 or 5 more. All right, John Potts. John Potts, you have asked a number of great questions. They're in the okay, I'm going to take you off of mute. You actually have 3 or 4 really excellent questions. Hopefully we don't have a challenge with our audio. Hey, John, are you able to hear us? Yes, terrific.
Okay.
Would you please introduce yourself?
Yeah, I retired from Intel in 2008, where I was Director of Operations for the wireless group. Since then, I've mentored and judged at ASU Cipher for entrepreneurship and innovation. We have a big group gathering around MEMS and NEMS manufacturing, focused on healthcare technologies. And I was really interested in this conversation, how it might be an enabler for our systems to come online faster. Things like, imagine a colonoscopy that can be done in the comfort of your home for $50. A lot of medical tests today that are done in hospitals and clinics are going to be able to be done in the comfort of our home with the help of a lot of technology. But we got to get there. The technology will get there. But if the systems aren't allowed to operate, it's not going to do anybody any good. So it looks like maybe what you guys are talking about is a key enabler for my vision. I'm not looking for your guys' ideas.
Mohsen is clearly very excited about this. Go ahead and
John, I love John. John, you gotta talk to Elon Musk, and we can do the same. The first thing in Tesla, you drive your driverless Tesla, and you get your treatment. You know, the first diagnosis with Tesla. It's easy. You just need the system inside, and you have the blockchain. You know, permissioned blockchain. You know, everything is connected, and before you reach your work, the system says you can't go, and the driverless car going back to your home or to the hospital. You can do that.
Yeah,
but
I mean, does anybody else on this call believe that Apple is going to enter into healthcare very soon, using its platform to provide a host of, well, exactly as I explained in my question, sensory-based devices? I mean, imagine the iPhone 10 currently has the technical capabilities to diagnose your skin for potential cancers and then make you an appointment. But you got to use that front-facing camera to do it. So, but that's very soon, maybe next generation. You know, we'll be able to do the skincare doctor visits at home just by moving your phone's camera across your skin in the pattern that it's asking you to do, or using your phone to do physical therapy because it's watching you and making sure that you're moving in the proper direction and amount that it wants you to. And there's great commercials I've seen lately by a couple of insurance companies that tell me that they're certainly thinking about this big time. But I also believe that Apple might emerge as a player, which would be very cool. Subscription-based healthcare diagnostics in the comfort of our home. But how are they going to be able to supply us, you know, our meds based on the algorithms output from the input of the sensors that are in my home? That's a big question I have, and I can't answer it.
well,
So it's got to get FDA approved. It's got to get all the other. That's my question about who's the equivalent to CTIA for wireless in healthcare. Because to me, CTIA played a major role in accelerating the adoption of wireless technologies.
the role of standards and governance is that there are many organizations that are working to address those challenges in blockchain and healthcare. But my opinion, and I'd love to hear if the panelists disagree, there are still unmet needs in terms of leadership in different categories that people are working toward. I'm actually standing up a new organization that I haven't announced yet that's going to work on specifically barriers to adoption and addressing barriers to adoption. And I think that the CTIA as a metaphor is really useful. You know, you could look back at their accomplishments over time and see that. So
one of my questions was also about, does anybody happen to have seen or have a market model that has a taxonomy in place that appears to be accepted by, you know, the majority of the group of the players? That, because I've been looking for that for about a year and a half. I've looked thousands of them, but it's not what I'm looking for. Everything I look at uses the existing healthcare system as the starting point, and I don't think it's going to shake out that way. I think the doctors need to be very afraid, and the hospitals need to be very afraid. But you know, I think they're responding from the commercials and the things I read, and not being employed by Intel anymore. I don't have access to the data I used to, but you know, I got a good gut feeling that this is happening very quickly.
No, it can happen. I don't know whether it is Apple offering that kind of thing to the world or somebody else. Many of companies talking about it, but this is how the world is. At one point you have some guy standing up and saying, I have a disruptive technology, like you got it with Apple. Steve Jobs has done the same thing, and he was dictating the technology of the future. And we don't know who
Right.
this guy is. Maybe it is Patientory and you don't know it, and we don't know it. We are
Right,
working on
right.
it. In
Yeah.
practice, we have to work on it, and we should think out of the box, as you said.
Yeah.
That's
Yeah, I don't know if you guys can see my email, but anybody interested in continuing this discussion with me, just fire me an email. It's johnpotts@q.com.
Yeah, I love to
And,
continue this conversation with you, John.
Okay, great.
And you asked another question down a little bit lower on your list, which is what percentage of the healthcare value chain can PTOY capture? And
Right.
that segued into a question that I had as well, and a remark that the the slide that you have where there were all the different third-party DApps for different disease states that can be built on top of the PTOY blockchain network. I would love to just take a second, and it sounds like John was thinking along those same lines that I was. How are you looking at onboarding partners to build in that environment? Are there any that are going to be included at the beta level where a specific disease state or diagnostic scenario or what have you has been created? I'd love to hear your vision for how that's going to come together. Who'd like to take that one? And I'm leaving you on off of mute for a minute, John, if you want to remark.
All right.
Who wants to start?
This is John Potts again. Let me just add to your question, because I think maybe it'll help with an answer. Do you see PTOY as growing a platform based on what you're working on, or do you see it entering an existing platform or existing platforms to play a more valuable role in the value chain? Then you get back to the question of how much of the wallet do you plan on capturing, and how big is the wallet?
So I can start with that. So the vision for Patientory blockchain, which right now is open source, it's an open platform for developers, for companies to develop on. We see that onboarding again through membership systems. So part of that is really sourcing and looking for companies that want to integrate and the different use cases that they would like to have currently on that network. Our reasoning behind joining Hyperledger, we see multiple blockchains out there, but we also see the space of interoperability that needs to exist as well within that blockchain network. So, whether Patientory blockchain is just one of them, we definitely see the need for Oracle services and integration between, different networks. We're not at this stage, we're still pretty early. We don't know what the future of that looks like. But again, the whole premise behind blockchain is to create, the world's decentralized ecosystem where we have access to this data.
Yeah, it's great to hear the prioritization of cross-chain interop as part of the vision, for sure. All right, John. I'm going to go ahead and put you back on mute. We have time for one last question. Thank you for participating, John. Appreciate it. All right.
Yeah, can I have later on the email from John? Can we get this so I can send him an email? That would be great. Excellent.
Yeah, thanks.
Thank you, John. All right, I think the last, let's see. Oh no, we're still okay on time. No problem. All right, so Tina Penman made a great point about Apple, who already has made an enormous splash into healthcare to great impact. And Tina, I'm going to take you off of mute here in a second. You've got a really interesting background that you described. Really looking forward to hearing your perspectives and getting your questions on the table. Would you mind introducing yourself really quickly?
Hi, yes, my name's Tina Penman, and I serve as a regional research administrator. I'm also a doctor of audiology in addition to an adjunct assistant professor. So I have sort of like a diverse background, I guess you could say. I'm really interested in this, and I would love to talk a little more about your roadmap. It seems like right now you're strengthening the buy-in from healthcare providers and fellow researchers, et cetera. At what point do you plan to get and reach out to the general public? And then additionally, I'm wondering about the funding that is streamed to the foundation. How is that funding spent, and how do you fund the actual all of the operational costs that you have in addition from, or is that coming from the foundation, or is that also coming from PTOY, and are there other sources involved? Thank you.
And we're leaving you on. You can stay on, and we'll speak with you a little bit as we discuss your question, Tina. Ocean, you want to take that question about the capital structure for the foundation and sources of use and uses of proceeds?
Well, the foundation is basically the reason why we created this foundation is because the fund is actually in control of foundation. So of course we look at that to spend the money for the development, yeah, this is where and the revenue stream is. I mean, we expect that to come later on in a different form. So that means yeah, we spend the fund wisely for the development, but it is still a long way to go, and that is the separation we have. I mean, Krisa, you can add please your thought as well on top of it. That is what I wanted to say actually about the funding.
Yeah, just to add on that, you know, part of that foundation, as you can see on, we go back to our crowd sale, the funds are, you know, used also to look at those projects that would eventually implement within the network. And of course, the consortium would then be able to vote on, you know, where those funds go. So that's that portion. And then on Patientory Inc. side, traditional startup, we also raise capital from venture capitalists, and private equity.
So Tina, does that answer your question, or are you curious about more? Do you have a follow-on?
That definitely answers my question. I'm interested because I think about all the mobile applications, for example, that have emerged ever since smartphones became available, and they require costs to sustain them over the course of many, many years. One mobile application that I used for 5 years until it concluded was this mobile application called Pact, and it was a really fun and interactive system because it essentially rewarded users for partaking in certain activities and goals that they set for themselves. For example, let's say I committed to going to the gym 3 times a week. I would check in on that app 3 times a week, and I would place a bet on how much I wanted to wage if I didn't meet my goal. So let's say that week I only made it 2 times, in which case I would place, if my bet was $5, I would lose $5, and that would be disseminated to the remaining users in the community who did in fact meet their goal. And this was a really fun and interactive way to not only participate in a mobile application, but to further my health and to connect with other Pact members in the community, because there were other aspects to this app as well. The unfortunate side, however, is that after 5 years, I think the funding ran low and the app came to a close. It ended. So that's the thing with these blockchain technologies as well, is that I think it's important to make sure that the funding source is sustainable over the course of time.
Is it Pact?
Again?
I just wanted to know the spelling of the app she mentioned.
Tina.
Sorry, well,
Tina Mosen here. I think one of the reasons why we have this open source and we are actually having the Stiftung and working with other companies is exactly this. We know the money we have is never enough for that, what the dream we have. We have to continue with that. And I think the continuity in this area is very important. And I'm fully with you, having the fundament, having the framework, having the data in a right way blockchain in place. That is one huge task and challenge everybody has around the world, and we are focusing on the healthcare part. But what you explained right now with this application, that is again part of the dream. Without this fundament, it doesn't work as well. And it is you and other companies and other friends and other partners who would put their application on this blockchain protocol we are creating to give more benefit to the patients. So I personally, please colleagues on the call, correct me if you think differently. I don't believe that we can solve all the issues of healthcare as one company. We have to work together. We have to collaborate together. There are companies who should work together to really shape the future of healthcare. And that is my opinion. I mean, colleagues may have different opinion. Please share your opinion as well.
And I just want to get the name of the app you mentioned.
The name of the app was called, well, it started as Gympact back, I think, in January 2012, and eventually it became Pact. And I can send you additional details if you want to touch base offline.
That would be great. Thank you.
You're welcome.
So Tina, or Dr. Penman, I'm sorry, you had also brought up a great question about roadmap or process, process to growth. So there's been a lot of discussion of long-term vision. Maybe we could take a moment to discuss your question of roadmap and get to sort of a milestone view of what you think your priorities are going to be in the near term. And Dr. Penman highlighted, for example, is going direct to patients and getting a certain number of patients a key driver, or is it more signing up institutions? And what does that look like? Maybe speaking to that growth plan and roadmap a little bit would be really interesting. And I thought that was a great question, Dr. Penman. Who'd like to take that one first? How about you, Krissa?
I'll go. So are we specifically talking about Patientory Inc. roadmap or Stiftung roadmap? Because I want to definitely have those differentiations that we're definitely, working on two separate, projects and entirely two separate companies. And even though our paths cross at that point, we have different visions.
I think it would be, I think it would be super helpful to clarify the two roadmaps. Like, let's make it clear in the mind of the audience what the roadmap is for Patientory Inc. versus the Patientory Stiftung, and clarify it. I think that would be a great point. Maybe Krissa, you want to take it for Patientory Inc. and then we could have Mohsen articulate it for the foundation as those those separate entities. Go ahead.
Great, thank you. So as I mentioned, I mentioned this previously. We started out, really as a software application, with the intent of being able to empower patients and give them access to their data. We definitely saw blockchain as the golden key for being able to scale a software like Patientory. So where we are now, it's being able to also look at the Stiftung and see where they are in their network production in order to, have the app and dashboard available and accessible to healthcare organizations, but also their patients. So our major milestone, as you mentioned, is that first beta, how we're able to test and just get feedback from how an actual end user would use software. And our long-term vision, of course, is to scale this to as many patients as possible, knowing that there are over 7 billion people on the planet. Not everyone currently has access to digitized medical information, but part of that goal is to also touch, third world countries, underserved areas, and then look at this notion of, healthcare tourism. So what does that look like? When a patient has access to their health data, does this mean they can actually go anywhere in the country and see actual care as they travel with that data? So that's where we're really focusing on, how can we really, touch the lives of people? How can they use a software on a daily basis to really see and track their progress and see those realized improvements over time?
Krissa, can I just ask a clarifying question to make sure I'm understanding? When we're talking about the software here, there's the open source project, and that's held by the Stiftung. But then there's the front end mobile app, and that's owned by Patientory Inc. Do I have that right?
That's correct.
Okay.
That is not open. That's all proprietary technology. software.
The mobile application itself, owned by the corporation, not the for-profit corporation, not the nonprofit foundation, but all of the blockchain infrastructure, and that for the Patientory blockchain network, that is an open source project run by the Stiftung, right?
Correct.
Okay, I'm just wanting to make sure I'm clarifying that. Okay, and then and so now let's hear Mohsen's answer to the roadmap and growth milestones question for the Stiftung. And then before putting you back on mute, I'd love to give Dr. Penman an opportunity to react, and if that answered your question. Mohsen.
Yeah, but I would just use 3 words: education, collaboration, expansion. So we would like to educate people around the world. We can't start with the world. We start on the regional level, on the country level, to really have the community and advanced knowledge about healthcare, blockchain in healthcare. So that is a challenge we have in front of us, and we are going, step by step, phase by phase. So just helping people, creating, making this community bigger. And this will help us also to learn from each other. And for us, having a lot of learning, what do we do? How do we expand actually the Patientory blockchain protocol, which is an open source? I mean, this collaboration, this network will help us also to manage the future challenges. We will find out what they are, and then we have also projects around the world. We are making the first collaborations with key customers to really connect the data together, putting them together, and making the first experiences, with different dimensions. So I think we all still have to learn a lot. We have a great technology, and I don't believe that we are done. Having a Patientory protocol already there, and everybody can put and set on it. And the expansion is exactly the slide I showed to all of you today. Again, we can give the fundament together, all of this community. We will create this fundament, which is the protocol. It is the PTOY blockchain foundation. And the next step is, and this is where Tina is coming in, the usage of that. I believe also in the future, we may have also problems with the data quality in the future, but this is again the next step. So let's work together as a community, expand it, collaborate with each other, do the first huge projects together, learn from each other, and expand it to the world, and then think about artificial intelligence and those things we want to do since many years and we cannot.
Thank you, Mohsen. And Dr. Penman, any reaction before I put you back on mute? Follow-on question, anything like that?
Thank you for your time in answering the questions. When we talk about education and outreach, I feel like the marketing and branding for the foundation is going to be very different than the marketing and branding for Patientory itself. And I think it's important to make sure that those messages are clear and concise to be appropriate for the audiences that are intended. Thank you.
Thank you, Dr. Penman. Putting you back on mute. So I'm going to try Ravi again, who we had an audio problem with earlier, and we've been corresponding. So to give you a warning before I try him again, Ravi's got some questions about scalability on Ethereum, and I think that's a worthy topic to discuss, and how your private fork addresses some of that, and also maybe what you're looking at in terms of using public Ethereum in any part of any of your workflows, maybe at an identity level, things like that. Would love to discuss that, and I'm going to try taking you off of mute again. Ravi, is it going to work? No, it is not working. Okay, so I just asked that question, and it was well, wait, no. All right, so Ravi, are you able to speak for some reason, and it's just not showing up on the utility? No. All right, so sorry about that, Ravi. We're having a technical difficulty with the way you're accessing it for some reason. So Vijay, maybe you could speak a little bit to the points that I brought up that came through Ravi in terms of Ethereum scale, the private fork, whether there's going to be any interaction with public Ethereum for any portion of the clinical and business workflows you'll be orchestrating. Thoughts on that?
Sorry, I was on mute. That's a great question. So we follow the Ethereum very closely, and whatever the enhancements that comes into the network, we are going to incur that to our network as well. With respect to the private permission blockchain, which we are working on for the PTOY, again, the same issues what we see in Ethereum is going to be there. When it gets improved, we are going to incur that to our network to apply those fixes to our network. But with respect to the other issues, like maybe we are not exactly the same copy of what we have seen in the public. With respect to some of the problems like the consensus mechanism, because they are using the power, a proof of work model, but we are not going to use that within our network. We have some changes to take care of the issues which we see in the public Ethereum. So that's how we address that, but we are closely following the releases what Ethereum community is going through, and we eventually get that updated to our network to make it in sync with what we have there.
On the topic of identity and potentially, are you envisioning any potential future interaction with public Ethereum, perhaps for identity management purposes?
Sure.
And are you looking at the ERC 721 standard that can hypothetically be used to establish a compartmentalized identity? Are you looking at that at all as a model? And I'd love if you could give just one layer of detail more on identity management under this paradigm, between public Ethereum identity management projects and what you're going to be using and so on. And it could be preliminary. I understand.
Yeah, exactly. As you pointed out, we are working right now on the current issue. We have not given much attention to the ERC 721 compliance. We are handling it in our way. There are interactions with the public Ethereum network through our Oracle services. These services are meant to interact with the smart contracts to communicate between the networks what we have onto the public blockchain. So that's how we handle it now. But definitely, once things get mature, we are in a position to incorporate those changes and include that into our network to make it more compliant with the public network.
Mm-hmm. Very, very interesting. Any other panelists want to react to engaging with the Ethereum community, the Ethereum Enterprise Alliance? Any of those? Any comments about what it's like from your perspective, having been part of that community and building and working in that community? Thoughts on that? No. All right. So I think that we have a couple of more questions, but we only have 4 minutes left. So what I'd like to do is give each one of our panelists an opportunity to make a closing statement, to get maybe summarize the key ideas and priorities you'd want the audience to come away with, and emphasize next actions. And before we do that, I'm going to run our last poll, which is asking the audience, whether they'd like to be contacted by one or the other of the Patientory team. So go ahead and vote. You should see that UI pop up pretty quickly. We've got 20% of you have voted. If you see the utility, please. Okay, we've got a lot of votes coming in now. Thank you very much. I know this really means a lot to the participants who take the time to come and present their vision on this webinar series. Okay, I'm going to close the poll and share the results. Okay, so we have 75% of our attendees voted that they'd like information on both. That's terrific. All right. So I wanted to give you an opportunity to make a closing remark, and then I have a couple of closeout things before we wrap up. Let's do Vijay, Michael, Mohsen, Krissa. Let's do it in that order. Vijay.
So, thanks for this opportunity. It's been really exciting to hear the words from from the people who attended this event and the tremendous interest they show us in the product what we are building out. And the seminar or the webinar, actually give an opportunity for us to convey what we have been developing on the background, so that which will be helpful for the people and the patient who is really in need of solving some of the real world problems. So we are really excited. We wanted to look forward to have our beta release as soon as possible.
Thank you, Vijay.
I'd just like to say thank you to everybody. It's been wonderful to hear the comments and the questions, and we're going to incorporate this into our future strategy and where we would like to see ourselves go with the foundation and working with Patientory Inc. here in Atlanta. But I would really like to encourage you to continue this conversation at the summit on May 31st in Atlanta. And it would be a pleasure to meet all of you in person, whoever can show up. You've just heard that Heather will be a speaker at the summit, which I think I just saw 50 more tickets be sold after that announcement, thanks to Heather. I think we now found how we're going to communicate in the future. You asked earlier, how are we going to get the word out? It's Heather, PTOY channel. So thank you. Thank you. And we'll see you May 31st.
Yep. Mohsen. Oh, I think you're muted.
I'm sorry, no, I was on mute. Yeah, excited that we have this first conversation. I have learned also from the questions a little bit, and I will take this with myself and see how I can learn more about those topics. I think the message I have to the audience is the following. Since 20 years, people are working to do that we are trying to do now. And that is a huge project. With blockchain, we can actually make it now, finally. And I don't believe one company can make it. So this conversation is the start of it. And I think we are on the right way, really to achieve what we want to achieve, namely having the data together, blockchain, so that we can really own our data, very secured, in the right environment, and then start getting benefit from that. That is the first challenge. And I don't think that Mohsen or Krista or anybody can do that alone. We can do that together. And there's a lot of learning on that journey. I look forward to work with each person who's interested in healthcare, and I admire everybody who wants to shape the future of healthcare. Please drop me email whenever you want, have conversation with me, and I look forward to spend time with you guys. Thank you.
Thank you, Mohsen. And Krista.
Absolutely. I just want to say thank you to the audience for tuning in and being able to listen to our story. Just to recap, we're very excited to present Patientory Inc. and Patientory Stiftung. Patientory Inc., which is a distributed application that serves healthcare organizations to retrieve access to healthcare data by employing machine learning and AI protocols, which is integrated on top of the PTOY blockchain network that is governed by the Stiftung. So we just wanted to have the audience, to really have that takeaway and to know that, of course, like most mentioned, this is a collaborative effort. We cannot do it by ourselves, and I definitely encourage you all to join our community on Slack, email us with any insights, and follow us on social media. Thank you.
Thank you very much, Krista, Mohsen, Michael, and Vijay. It's been a real pleasure to speak with you today, and thank you so much for taking the time to come on the Blockchain and Healthcare webinar series. We really appreciate it. Just a quick word, this webinar series is proudly produced and sponsored by Obesity Prevention Policy and Management, and produced in partnership with the Healthcare Conference Network. That organization has 2 events coming up that I want you to be aware of. One is in Toronto in June, that's Blockchain and Healthcare Canada, and one is November 14th and 15th in Washington, D.C., Blockchain and Healthcare East. I'm part of both of those. Hope to see you there, and very excited to see as many of you as possible at the Patientory Summit in Atlanta on May 31st. It's coming up quick, and it's going to be terrific. So thank you to everybody. I hope you have a lovely day, and this will be recorded and posted for redistribution. Bye-bye.
Thank you.
Thank you.
Thank you very much.